A disease that kills millions today was already stalking humanity thousands of years before anyone understood what a single cell was. Ancient people had no microscopes, no chemotherapy, no radiation, and no concept of DNA. Yet they still encountered strange lumps that grew, spread, and often ended in death. The greatest mystery wasn't whether cancer existed. It did. The mystery was how ancient civilizations tried to fight an enemy they couldn't even see. For most of human history, cancer was invisible until it became impossible to ignore. A person might notice a hard lump beneath the skin, experience constant pain, suffer unexplained bleeding, or gradually become weaker month after month. Families watched loved ones decline without understanding why. To them, the disease seemed to appear out of nowhere, growing slowly before taking complete control. Yet ancient healers refused to look away. They observed. They compared symptoms. They remembered previous patients. That careful observation became the foundation of early medicine. The oldest known written descriptions of cancer come from ancient Egypt. Around 1600 BCE, the Edwin Smith Papyrus documented several surgical cases, including hard masses found in the breast. Scholars believe the text itself was copied from even older medical knowledge, making these observations among the earliest surviving descriptions of what modern historians identify as cancer. The physician examined the swelling carefully. He described its firmness. He noted that touching it produced no fluid. Most importantly, he recorded his conclusion with remarkable honesty. There is no treatment. That single statement reveals something extraordinary. Rather than inventing a false cure, the Egyptian physician admitted that the disease lay beyond the limits of contemporary medicine. In a world where illness was often explained through religion, spirits, or magic, acknowledging that a condition could not be cured demonstrated unusual medical realism. It was the beginning of humanity's longest battle against cancer. Ancient Egyptian doctors were far more skilled than many people imagine. They stitched wounds, set broken bones, treated infections, performed surprisingly advanced surgical procedures using bronze or copper instruments. Medical papyri describe examinations, diagnoses, and treatments that followed organized methods instead of random guesses. So why didn't they simply remove every tumor they found? Because cancer doesn't behave like an ordinary wound. A cut has visible edges. A broken bone has a clear location. A tumor can extend far beyond what the eye can see. Ancient surgeons had no knowledge of cells, no understanding of metastasis, and no way to detect disease hidden deep inside the body. Even if they successfully removed a visible growth near the surface, they had no reliable method to know whether similar disease had already spread elsewhere. Their greatest obstacle wasn't courage. It was knowledge. Imagine trying to stop a fire while seeing only the smoke rising above the ground. That's how cancer appeared to ancient physicians. They could observe the damage. They could not see its true source. Even today, cancer remains one of medicine's greatest challenges despite advanced imaging, laboratory testing, and sophisticated surgery. For ancient healers working thousands of years ago, the challenge was almost unimaginable. Still, they did not stop searching for answers. And some of the treatments they experimented with would influence medicine for centuries to come. While Egyptian physicians left some of the earliest written descriptions, they were not the only people trying to understand mysterious tumors. Across the Mediterranean, Greek doctors began asking a different question. What if disease followed natural laws instead of supernatural ones? That idea changed medicine forever. Among the most influential physicians was Hippocrates, often called the father of medicine. Living during the 5th century BCE, he believed illnesses had physical causes that could be observed and studied. When he encountered certain hard tumors with swollen blood vessels spreading outward, they reminded him of a crab. The Greek word for crab was karkinos. That is where the modern word cancer ultimately comes from. The name wasn't chosen by accident. A crab's legs spread outward from its body. Many tumors appeared to do the same. Although Hippocrates misunderstood the true cause of cancer, his method of carefully observing patients marked a major step forward. Instead of blaming every illness on angry gods or evil spirits, he encouraged physicians to study symptoms, compare cases, and draw conclusions from experience. His explanation centered on the theory of the 4 bodily humors. He believed cancer resulted from an excess of black bile collecting in the body. Today, we know that theory was incorrect, but for nearly 2,000 years it shaped medical thinking throughout Europe and parts of the Middle East. The explanation failed. The careful observation endured. Centuries later, the Roman physician Galen expanded upon Hippocrates' ideas. His medical writings became some of the most influential texts in history. remaining standard references for well over 1,000 years. Like Hippocrates, Galen believed black bile played a central role in cancer, but he also recognized something important through experience. Not every tumor behaved the same way. Some remained small for years. Others grew rapidly. Some caused little pain at first. Others became unbearable. These differences puzzled ancient doctors because they expected diseases to follow predictable patterns. Cancer refused to cooperate. Galen generally advised against operating on advanced tumors, especially those involving the breast. Through repeated observation, physicians had noticed that patients with widespread disease often deteriorated quickly after aggressive surgery. Without anesthesia, antiseptics, blood transfusions, or antibiotics, major operations carried enormous risks even before considering cancer itself. Sometimes the operation caused fatal infection, sometimes severe bleeding, sometimes the disease returned anyway. To ancient physicians, these outcomes reinforced the belief that certain cancers were beyond human control. Even so, they never completely abandoned treatment. When surgery seemed impossible, they turned to another weapon they had relied upon for centuries: the natural world. Plants, minerals, oils, and countless herbal mixtures became their next line of defense, beginning one of the longest searches for medicinal compounds in human history. Long before scientists could isolate chemicals in a laboratory, ancient healers searched forests, mountains, deserts, and riverbanks for plants that might ease suffering. They experimented constantly. Some remedies failed completely. Others reduced pain. A few unexpectedly contained compounds that modern science would later recognize as medically useful. Ancient Egyptian physicians frequently used honey when treating wounds and ulcers. Today, we know honey possesses natural antimicrobial properties that can help reduce bacterial growth. It could not cure cancer, but it sometimes protected open sores from infection and made patients more comfortable. Olive oil, resins, figs, garlic, willow, frankincense, and numerous medicinal herbs appeared in medical texts across different civilizations. Physicians combined them into ointments, drinks, poultices, and compresses based on generations of observation. Most of these treatments targeted symptoms rather than the disease itself: pain, inflammation, bleeding, bad odors from ulcerated tumors. Although ancient doctors lacked knowledge of cancer cells, they recognized that relieving suffering still mattered. That idea survives in modern medicine. Today, supportive and palliative care remain essential for many cancer patients, even when eliminating the disease is impossible. Ancient healers understood compassion long before they understood biology. Surgery, however, remained the boldest option available. If a tumor appeared close to the surface and seemed confined to one area, some physicians attempted to remove it with knives heated over fire or made from carefully sharpened metal. These operations demanded extraordinary courage from both doctor and patient. There was no general anesthesia, no sterile operating room, no antibiotics waiting afterward. Patients were sometimes given alcohol, herbal sedatives, or preparations containing opium or mandrake to dull pain, but none produced the complete unconsciousness expected during modern surgery. Every cut carried enormous danger: infection, shock, blood loss. Even a technically successful operation could become fatal days later. Because of these risks, experienced physicians often chose patients carefully. Ancient medical texts suggest that some tumors judged small and accessible might be treated surgically, while advanced or deeply rooted masses were frequently left untouched because intervention appeared even more dangerous than the disease itself. This was not cowardice. It was practical judgment based on repeated experience. Ancient surgeons understood their limits. They could remove visible tissue. They could not remove microscopic disease spreading beyond the edge of the knife. Still, each operation added another lesson. Each patient taught something new. Step by step, century after century, humanity slowly gathered the knowledge that would eventually transform surgery into one of medicine's most powerful tools. But the search for answers did not stop in Egypt, Greece, or Rome. Across Asia, entirely different medical traditions were developing their own approaches to mysterious tumors, often reaching surprisingly sophisticated conclusions through careful observation alone. Thousands of miles away from the Mediterranean world, ancient Indian physicians were developing their own understanding of diseases, including abnormal growths that resembled what we now recognize as tumors. One of the most famous names connected with early Indian surgery is Sushruta, a physician who lived roughly around the 1st millennium BCE. The medical tradition associated with him, recorded in the Sushruta Samhita, described detailed surgical procedures, anatomical observations, and methods for treating various physical conditions. Among these practices were attempts to remove certain growths from the body. These procedures show something important. Ancient surgeons were not simply accepting disease as fate. They were actively investigating whether the human body could be repaired. However, removing a growth was not the same as curing cancer. Without microscopes, physicians could not see abnormal cells multiplying beneath the surface. Without knowledge of genetics or immune responses, they could not understand why some tumors returned after removal while others did not. They were fighting a hidden enemy with visible tools. Still, their work represented a major step in medical history. The willingness to study the body, perform surgery, and record observations created a foundation that later generations would build upon. Ancient Chinese medicine also developed theories about tumors and abnormal body changes. Chinese physicians created detailed systems for understanding illness through observation of symptoms, body patterns, and environmental influences. Medical texts from ancient China described masses, swellings, and conditions that resemble some forms of cancer. Treatments often focused on restoring balance within the body using herbal preparations, acupuncture, dietary practices, and other methods. Many of these explanations do not match modern medical science, but the process behind them reveals something valuable. Ancient doctors were trying to identify patterns. They noticed that certain conditions developed slowly. They noticed that some illnesses affected different parts of the body. They noticed that lifestyle, age, and environment appeared connected to health. Modern medicine would eventually explain these connections through biology, genetics, and cellular science. Ancient physicians reached toward those answers without having the tools to fully discover them. Their greatest contribution was not always the accuracy of their theories, it was the habit of investigation. One of the biggest misconceptions about ancient medicine is that people were completely helpless against serious diseases. The reality was more complicated. They were limited, very limited, but they were not ignorant. Ancient healers understood anatomy better than many people assume. They recognized patterns of disease. They developed surgical techniques. They created written records. They tested substances from nature. They passed knowledge from one generation to the next. Their methods could not defeat cancer, but they were the beginning of humanity's attempt to understand it. Every modern cancer treatment, from surgery to chemotherapy, exists because countless generations before modern science asked the same basic question. What is happening inside the human body? Ancient physicians asked that question while standing in a world without electricity, laboratories, or advanced technology. Their answers were often incomplete. Sometimes they were wrong. But the curiosity itself was revolutionary. And as history moved forward, that curiosity would lead to one of the most important discoveries in the fight against cancer. The realization that the disease was not a mysterious imbalance or punishment. It was something happening at the smallest level of life itself. For thousands of years, humans searched for the cause of cancer without knowing where to look. They examined the outside of the body. They studied symptoms. They created theories about fluids, energy, and balance. But the true battlefield was hidden inside something far smaller than anyone could imagine. The cell. Before microscopes became powerful enough to reveal the microscopic world, cancer remained a mystery. A tumor was visible, but the process creating it was invisible. Then science changed. During the 17th century, improvements in microscopy allowed researchers to observe structures that no human had ever seen before. For the first time, scientists began understanding that living things were made of tiny building blocks called cells. This discovery completely transformed medicine. A tumor was no longer just a strange mass. It was a collection of abnormal cells growing in ways they should not. That realization separated ancient explanations from modern understanding. The disease that ancient physicians described through appearance and symptoms could now be investigated at its true source. However, this breakthrough did not immediately create a cure. Understanding cancer was only the beginning. Scientists still had to discover why cells became abnormal, why some tumors spread, and how treatments could destroy cancer without destroying healthy parts of the body. The ancient struggle continued, but humanity finally had a clearer enemy. One of the earliest examples of cancer discovered in human remains comes from ancient Egypt. Researchers studying mummified bodies have found evidence of tumors and bone damage consistent with certain cancers. These discoveries are important because they prove something many people once doubted. Cancer was not created by modern lifestyles alone. It existed thousands of years ago. Ancient people lived shorter lives on average, which meant fewer individuals survived long enough to develop some cancers that are more common in older populations today. But cancer itself was already part of human history. Archaeological evidence has revealed signs of malignant disease in ancient remains from different regions and time periods. Some individuals showed signs of bone tumors. Others displayed damage caused by cancers that had spread. These discoveries create a direct connection between ancient patients and people today. A person living thousands of years ago could experience the same biological process happening inside their body as someone in a modern hospital. The difference was not the disease. The difference was the tools available to fight it. An ancient person facing cancer had observation, experience, and limited treatments. A modern patient may have surgery, radiation, chemotherapy, immunotherapy, and genetic analysis. The disease remained familiar. The battlefield changed. The history of ancient cancer treatment also reveals a difficult truth. Sometimes the most important medical advances came from recognizing failure. Ancient doctors tried remedies that did not work. They performed surgeries that could not save every patient. They created theories that later proved incorrect. But each failure provided information. Medicine grows through correction. A wrong idea can still lead someone toward a better question. When Hippocrates connected tumors with the image of a crab, he did not discover the true cause of cancer. When Egyptian physicians recorded tumors without a cure, they did not solve the disease. When surgeons attempted early operations, they did not eliminate cancer forever. But together, these efforts created a long chain of knowledge. Modern medicine did not appear suddenly. It was built on thousands of years of human curiosity, including the mistakes and limitations of ancient healers. The fight against cancer is one of the longest battles in medical history, and the first warriors were people who had almost no weapons except observation, determination, and the belief that even the most frightening diseases could eventually be understood. By the time ancient civilizations disappeared and new medical traditions emerged, humanity had learned one important lesson about cancer. The disease was not a curse that appeared without reason. It was a physical process happening inside the body. That realization took thousands of years to develop. Ancient healers began with what they could see: a strange swelling, a painful mass, a wound that refused to heal, a person slowly becoming weaker. They could not see cells dividing uncontrollably. They could not see genetic damage. They could not understand how a tumor could send invisible seeds of disease throughout the body. But they recognized the pattern. Something inside the body had gone wrong. That simple observation became the starting point for everything that followed. The history of cancer treatment is not a story of one genius discovering a miracle cure. It is a story of countless people adding small pieces to a puzzle. An Egyptian physician recording a tumor, a Greek doctor studying symptoms, an Indian surgeon attempting removal, a Chinese healer documenting patterns, a researcher centuries later examining cells under a microscope. Each person pushed humanity slightly closer to the truth. The darkest part of ancient cancer treatment was not always the disease itself. It was the suffering caused by having so few options. A patient with an advanced tumor might experience unbearable pain, weakness, and changes to their body that ancient medicine could rarely reverse. Doctors could offer comfort. They could clean wounds. They could apply mixtures. They could provide food, rest, and care. But stopping the disease was often beyond their ability. This created a different role for ancient healers. They were not always conquerors fighting an enemy. Sometimes they were companions standing beside someone during an impossible battle. That role remains important today. Modern medicine has powerful treatments, but doctors still recognize that healing is not only about removing disease. It is also about reducing suffering and protecting a person's quality of life. In this way, ancient physicians and modern doctors share something fundamental: the desire to help people survive difficult moments. Perhaps the most surprising thing about ancient cancer treatment is how familiar some of their challenges feel. Even today, doctors face questions that ancient physicians also struggled with. Why does one person develop cancer while another does not? Why does one treatment work for one patient but fail for another? Why can a disease disappear and then return years later? The difference is that modern science has powerful tools to investigate these questions. Ancient humans had only their senses and experience. They watched, they recorded, they experimented. They learned slowly. The journey from ancient tumor descriptions to modern cancer therapy took thousands of years because cancer is not a simple enemy. It changes, it adapts, it hides. That is why the story of cancer is also the story of human persistence. A disease that existed before written history still challenges humanity today. But every discovery, every treatment, and every survival story comes from a question ancient healers asked first. What is happening inside the human body, and how can we stop it? The answer was not found in a single ancient remedy or forgotten medical secret. It was built through generations of curiosity, failure, discovery, and determination. The same qualities that allowed humans to survive the harshest environments on Earth also pushed them to confront one of their oldest enemies, cancer.